if people who have uh, um, different thrombosis or DVT or A, the AFib that cannot be controlled by warfarin with the go-to three. For example, people have been taking warfarin with the iron rank between 2 and 3, but still have stroke or still have recurrent DVT or PD. They may increase the iron range to 2.5 to 3.5. Make sure they're not having stroke or the recurrent DVT or PD when they are at therapeutic level. And sometimes they have the patient additional medication like aspirin. Then the current DVT, OPD, stroke, and take over. And sometimes some people very high risk of bleeding. They may want to have those patients a lower iron range, maybe have to be below 1.8. Sorry, maybe 1.5 to 2.5. So for those people, they are very high risk of bleeding. Have any further question, please? I'm going to talk a little bit about vitamin K food for people who are on warfarin as a blood thinner medication for certain medical conditions, DVTs, like different legs, or pulmonary embolism like PE, or AFib, defibrillation. So for those people who have to take warfarin, most of people who have AFib and need to take the warfarin because they have certain conditions like mechanical blood valves in their body. So how concerned about the vitamin K food to warfarin and other oral anticoagulants like Alaquix, Geralto, or Badaxa. So vitamin K does not affect other oral medication like Geralto, Alaquix, or Badaxa. It does affect warfarin. So when you when you go to Google and you type vitamin K foods and warfarin, you can find some information about vitamin K food, what food contain vitamin K, and some foods contain more vitamin K, some food has less vitamin K. On Google, usually they have all the common questions like people also ask when you concerned about vitamin K and warfarin. So some questions like, can you eat foods with vitamin K and warfarin? What food should be avoided when taking warfarin? What vegetables are okay with warfarin? The vitamin K uh, raise your iron level. So these just some most common question when people concerned about vitamin K when they are on warfarin. So in, excuse me, in general, uh, in general, you should not stop vitamin K food completely when you're on warfarin. Because if you stop completely, it's not healthy to stop vegetables completely or stop greens completely. You should eat some vitamin K, which is found in vegetables. So you should eat some greens, but you need to be consistent with your vegetables. You should eat same amount of vitamin K or same amount of greens every day to make sure your warfarin stable in your body. You have to eat consistent. You need to know how to measure your vitamin K. For example, uh, spinach or kale contain a lot of vitamin K. So if you eat, I would recommend that you should eat low to moderate amount of vitamin K. So if you eat half of a raw spinach for one day, the next day you should eat like 2 or 3 cups of raw cucumbers or tomatoes like that. But dark leafy vegetables or dark leafy greens contain more vitamin K, like kale, spinach, light vegetables contain less vitamin K, like cucumber or tomatoes contain much less vegetable, less vitamin K. So I would recommend that you should eat a low to moderate amount of vitamin K, but you must be consistent every day to make sure that your warfarin stable stabilize in your body. Generally, when you see this question, can you eat food with vitamin K on warfarin? Yes, I would say yes. You can eat some food with vitamin K, but you must be consistent and you should know how to measure the amount of vitamin K in each food in order to make sure you eat a similar amount every day. What foods should be avoided when taking warfarin? Well, I don't think that you need to avoid any foods when you're on warfarin, especially the food affect your warfarin like greens or vegetable. But some foods, may um, affect your bleeding, like garlic, or some um, other herbals, it may increase your INR, so it may increase your bleeding. So I uh, try to avoid those medication may cause bleeding. The vitamin K does not increase your INR level or does not raise your INR level. It decreases or it lower your INR level. So what it means when it's low INR level? So when your INR low, you are at increased risk of blood clot. When your INR level is high or critical, is increased risk of bleeding. That is why you have to make sure you are in stable and in the range. Um, there are two typical range. One, the normal range for certain medical condition like EVT, AFib, the normal range between 2 and 3 for the INR. For mechanical heart failure, the INR level is between 2.5 to 3.5. So it depends on medical condition. You have a different INR range. You have any further question on this topic or the issue? Please let me know in the comment below. Thank you.
Hello, Yatu. This is a good question. What is difference between both? I don't know. I say Motrin is a non-inflammatory steroid drug. So it's used for mostly for inflammation pain, like ache or muscle pain, muscle cramps,